Do you shudder to think what it's going to be like in January?
I do, Eddie. It's a real worry. I think for many of us, for staff, for patients, actually this feels like deja vu. We were in exactly the same position at the end of February, early March, where we couldn't access tests, vulnerable patients couldn't access tests, and staff were sitting at home. Now, we've had many months to learn from those mistakes during the first wave, and here we are with cases increasing. I'm an intensive care doctor. We had our first ventilated patient for COVID in over the weekend. We are very worried that we're heading into a second surge, and yet again, we're seeing the very same problems arise.
And yet, as we heard in the case of Keir Starmer, it's often problems at home. I mean, I hear what you say about health professionals being unable to get tests, but often when family members get sick and there's a concern they might have COVID, whether or not they can get tested, whether or not they can get the results quickly, will also have a knock-on effect on all sorts of areas of work, including, of course, the NHS.
You're absolutely right, Eddie. The result is exactly the same. And ultimately, that still means that people are having to self-isolate at home when they could and should be at work. And you mentioned about vulnerable family members being ill, or indeed children. We've heard from doctors today who have been told to put their unwell children in a car for 7 hours, drive down to the coast, get a ferry over to the Isle of Wight just to get a test. One doctor told us, a GP, and GPs are having a real problem because they can't access staff testing through hospitals like hospital staff can. So they are having to access the same the same pathway, the same government pathway as the public. One GP said that they did manage to access a test through their local hospital, but they could only test one family member. So she had to choose between her children as to who was the most sick, and then they got a test. But ultimately, because the whole family has not been tested, that GP will be off work for 2 weeks, and ultimately that impacts on our patients.